My name is Ellen Nichols. I work for the Health Initiative. I am a master trainer for the programs of chronic disease self-management. This is a program that was developed by Stanford University out in California. It is an evidence-based program that had numerous years of research and development for outcomes. It was developed by a team of experts. There were physicians, nurses, social workers, health educators, physical therapists, occupational therapists to have outcomes that were positive to show how people can self-manage the chronic illness they may have, whether it's physical or mental health chronic illness. And it is meant to help people with day-to-day living skills to manage those illnesses in their day-to-day living when they're not at a provider's office.
My name is Julie Cook and I work for the Health Initiative. I am a master trainer for the Chronic Disease Self-Management programs. So the Chronic Disease Self-Management program is a 6-week-long program that is designed for folks that have a chronic condition in their world, or they are supporting someone in their world that has a chronic condition. Folks meet once a week for 2.5 hours. We gather up a bunch of tools to help self-manage. We learn about the symptom cycles. Folks with chronic conditions experience poor sleep, or fatigue, or pain, or shortness of breath, stress, anxiety, difficult emotions. And that goes with most conditions that one would have in their life. So it's not any one type of condition. These programs are designed to self-empower folks so that their condition does not define them. And it helps them to manage through the world on a day-to-day basis. We work at decision-making, communication, using your mind, problem-solving, breathing techniques, working with our healthcare professionals, and I think the mainstay of the program is action planning. Every week we work on an action plan. That's something that we can see ourselves doing within that 1 week when we go off. And we ourselves have done a little research. We've followed up with some of our folks after they've been with us for about a year, and then asked them, where are you at a year now after you've completed the program? Do you still have action plans in your world? And 90+% say yes, at some level I'm still doing action plans every week. And yeah, it helps them to view the world through a different lens, a very capable lens.
As a provider, you will value these programs for your clientele. First of all, one of the benefits of referring someone to one of these programs is that it will self-empower your client to manage their day-to-day skills that they need to maneuver the world right now with a chronic health condition. And one of those good outcomes from a provider perspective is decreased visits to the emergency room, decreased inpatient admissions to your hospital, perhaps decreased phone calls to your office staff, a better understanding of how to communicate with you, the healthcare provider, their concerns, how to communicate with their family, their loved ones, their friends on what's going on in their lives. So these are all benefits to these programs to refer your clients to.
Hi, my name is Mary Mitica. I'm a registered dietitian, certified nutritionist practicing in the North Country for more than 30 years. I've been sending referrals to the Health Initiative for more than 10 of these years, specifically utilizing the diabetes prevention and self-management programs, and most recently, the Chronic Disease Lifestyle Change program. These programs are comprehensive. They deal with a number of topics such as nutrition and physical activity. They help patients in problem solving and setting goals for themselves to reach areas of improvement such as weight loss, improving blood sugars. The weekly support and encouragement from both the leaders and peers participating in conducting the classes enable the patient to reach his or her goals and exceed the amount of time that a single practitioner could provide in an office visit. And for this reason, I highly recommend sending referrals to this program.
Providers can refer patients through their local New York Connects program, where staff have been trained to help patients understand their program options and will help them get enrolled. So my name is Anne Marie Snell, and I'm the Executive Director for the St. Lawrence County Health Initiative. While the St. Lawrence County Health Initiative was formed in 1999, this was after a large community needs assessment where they found that St. Lawrence County was lacking in 3 primary areas, and those were really nutrition and physical activity, substance abuse, and at that point in time it was teen tobacco use that was the concern in our community. And the final area was access to care. The Health Initiative was formed with the mission to measurably improve the health of St. Lawrence County residents and residents of the North Country region through collaborative community efforts. And I want to point out 2 important points in that mission is that measurably, so looking at data, trying to really improve the health of St. Lawrence County residents, and then collaboration. Collaboration is key for us. So we work really closely with statewide, national, and local community partners to improve the health of St. Lawrence County residents and residents of the North Country region. The project that we're working on right now with the North Country Healthy Heart Network and the North Country Chronic Disease Prevention Coalition is really great. It is integral to our mission. But really it drives and it draws upon the work that we've been doing for so long. So we began this work a little over a year ago, where we shifted from providing the workshops in the community to training our local delivery organizations and providing those delivery organizations with technical assistance. What this looks like for us is that we support our community in having the capacity to deliver strong evidence-based programming to our patients. We want to ensure that our providers know whether they refer their patient to a program in Glens Falls or right in Potsdam, that they're going to receive the same exact program. Their patients are going to receive exactly the same materials, exactly the same education, and the same support from their highly trained peer leaders.
I'm Ann Morgan, the Executive Director for the Heart Network in Saranac Lake. The Heart Network also is the lead facilitator for the North Country Chronic Disease Prevention Coalition. So the North Country Chronic Disease Prevention Coalition is a network of medical and behavioral healthcare providers, community-based organizations, and other regional stakeholders interested in reducing the burden of chronic disease in this region. Working together, not only are we hoping to reduce the burden of chronic disease, but we're also hoping to formulate a model that will allow us to sustain long-term delivery of these programs well into the future. The coalition was initiated in 2019 by the Heart Network as in an effort to replicate and even expand implementation of a project that, among other things, led to the ongoing establishment of a national diabetes prevention program in southern Franklin County. This was significant because over the last 5 to 10 years, organizations across the region have made multiple attempts at delivering programs like the National Diabetes Prevention Program, but we've been unsuccessful overall in being able to sustain that program delivery because recruiting the numbers of participants needed was very difficult. As a result, North Country residents have had extremely limited access to these really truly life-altering programs. To increase availability and access to these programs, the coalition includes members who have agreed to deliver programs. We call these our delivery partners. It includes a leader training and technical assistance center that offers support to those organizations and helps to get individuals working or volunteering with those organizations trained so that they can help to facilitate workshops. It includes medical and behavioral healthcare providers from across the region who have agreed to more actively identify and refer patients who might benefit from these programs to the programs so that they can get connected to these services. And it includes area offices for the aging who are playing a very important role in that they're able to accept those referrals from providers, have a more detailed conversation with the patient about what kinds of programs and what format program delivery they might benefit from, and then they help to get those individuals enrolled in the program. All of these stakeholders come together to create the foundation, or the backbone, we could say, for what ultimately we hope will become a community-integrated health network. By working together to deliver these programs in a unified and consistent way, really increases the coalition's ability to secure contracts that will help to pay for these programs and sustain them for the long term, well into our future. You can either give us a phone call at 518-891-5855 or send me an email, amorgan@heartnetwork.org. To learn more about the coalition, visit heartnetwork.org.